have had quarterly performance dialogue with states. We have had multiple engagement with state governments, with commissioners of health, with our development partners, through various working groups, which have looked at the data, and we have used instruments such as the People's Perceptions Survey. Last year when we set the agenda, we had a People's Voices survey that was conducted, interviewing almost 2,500 Nigerians to get their perception. Because if you recall, the first pillar of the agenda is to improve governance and to orient Nigeria's health system to respond to the needs of Nigerians, which is the President's renewed HOPE agenda, the Health Sector Renewal Investment Initiative. This year we have a perception survey which is conducted across the 36 states, interviewing more than 2,600 Nigerians as a sample to get a sense of their perception on our way to continually assess how do Nigerians feel about the health system and the impact of what we are trying to do. We have now gotten the result of 2023 DHS, which is like a baseline, which has now been organized systematically across different states by different indicators to tell what has been the trend, so that in 2 years' time we can reliably come and say, okay, this improvement that we're talking about, here's how much we've achieved, here's how much we may not achieve, here's what we have learned.
The point of all of our engagements next week is to, one, establish a baseline. The second is, following the release of the State of the Health report, we know that we have suboptimal data systems. And so we are calling on all of our partners to mobilize and ensure that we have this joint investments to solve our data problems once and for all. The third thing is we need to bring this institutionalization of our joint accountabilities. In the past, it was development partners that used to force these kinds of conversations. But today, the government is leading in terms of institutionalizing the joint accountability for our results.